The number one most common misconception that people with type 1 diabetes have about their own type 1 diabetes is what triggered the onset of their symptoms. If you think that the flu or chickenpox or a vaccine or a divorce or puberty or going to college caused your type 1 diabetes, you need to watch this video. I'm going to preface this by explaining that there is no mystery here. It's not a controversy. There's no like, oh, we need to really look into this. They've been looking into this for decades. They already know that there are 3 stages of type 1 diabetes. And most of us don't find out that we have type 1 diabetes until stage 3. Okay, get this, and this might blow your mind, okay? The earliest stages of type 1 diabetes probably developed in your body years or even decades before you were diagnosed. That means, by the way, that case of chickenpox or the flu vaccine that you got a week or a month prior to your symptoms, prior to your diagnosis, did not cause your type 1 diabetes. Okay, so thanks to decades of research with TrialNet and Breakthrough T1D and other organizations around the world, here's what they know about the development of type 1 diabetes. Stage 1, you test positive for autoantibodies of type 1 diabetes. But most of us are not getting tested at stage 1 because we're not looking for it, because we don't have symptoms. So stage 1 can be diagnosed if you test positive for at least 2 of the 5 autoantibodies that are known to develop in the body when your immune system starts attacking the cells that produce insulin. So you test positive for 2 of these 5 different types of autoantibodies, but you don't have any symptoms. Your blood sugars are still completely normal. You're still producing plenty of insulin. Long before your vaccine or your flu or the chickenpox. Stage 2 of type 1 diabetes. You still test positive for at least 2 of the 5 autoantibodies, but your blood sugars are also starting to look abnormal, which doesn't mean they're stuck high all the time. It just means like maybe you're going up a little bit and then you're coming back down. But when you're going up, that blood sugar spike, it's more significant than it would be in a non-diabetic who is producing a normal amount of insulin. Again, though, most of us are not looking for type 1 diabetes when we're in stage 2 because you still do not have symptoms in stage 2. You only have these abnormal blood sugar readings. You're still producing a lot of insulin. That's why all these clinical trials that are developing therapies where they're hoping to actually protect the cells in your pancreas that produce insulin from your immune system, they're always looking for people who are in stage 2 because those are the people who have insulin producing cells to protect. The goal is to prevent those people from needing to go on daily insulin therapy via injections or a pump. The hard part about finding people who are in stage 2 of type 1 diabetes is that they don't think there's anything wrong with them. You could tell them like, hey, you should go get screened for type 1 diabetes and everybody should go get screened for type 1 diabetes. They'll think, well, it doesn't run in my family. I don't have any symptoms. Don't need to get tested. This is why I've screened my own children so many times. I don't want to miss stage 2. I don't want to miss the opportunity to get them involved in one of these clinical trials or get them on the one FDA-approved therapy, Tzield, that exists today that could actually at least delay, hopefully, the need for daily insulin injections. But you've got to catch it with an autoantibody blood test. All right, stage 3. This is when we all normally find out that we have type 1 diabetes. Stage 3, you may or may not test positive for at least 2 autoantibodies. Most people test positive, but some people, for some reason, by the time you're in stage 3, some of those autoantibodies have kind of vanished. They don't know why. I haven't heard a good explanation of why, but it does happen. In stage 3, your insulin production is so low that your blood sugars are so high and your insulin production is so low that you are now in ketosis usually, and you're eventually in DKA if stage 3 goes on long enough before you're diagnosed. Now, here's the thing about the flu or chickenpox or puberty or a car crash or divorce or a vaccine that felt like to you that it caused your type 1 diabetes. The stressor of anything on your system around that time in your life was going to trigger the full onset of type 1 diabetes. If you hadn't just gotten the flu vaccine, it would have been the next time you got sick. If you hadn't gotten sick, it would have been puberty just around the corner. It's not one thing that caused your type 1 diabetes. That was just kind of an accelerator. It was like putting some gasoline on the fire, but anything could have been the gasoline because the attack on your pancreas had progressed to the point where it just needed one more stressor on your body to drive you to stage 3. It was gonna happen no matter what. Now, there are people who get screened, maybe their child was just diagnosed, so they get themselves screened for autoantibodies, and they test positive for stage 1 or stage 2. And I've met these people. They go decades without ever reaching stage 3. And the researchers don't know why. They don't know why these people can go decades of just hanging out in stage 1 and stage 2 while their children only manage to go, 10 years. There are also people who go decades in stage 1 or stage 2, and then they very gradually, over sometimes even the course of 10 years, evolve from a misdiagnosis of type 2 to needing daily insulin therapy by the time they're 60 years old. But it looked like type 2 at first because the attack on the pancreas was so slow that their blood sugars were only so high, and type 2 medications that made them more sensitive to insulin worked for a little while. But they had type 1 diabetes all along. Some quick facts for you. Type 1 diabetes can be diagnosed at any age. It is not a childhood disease. You can develop stage 3 of type 1 diabetes at 70 years old. 90% of the people who are diagnosed with type 1 diabetes have no family history of the disease, which means it doesn't matter if a whole bunch of people in your family don't have type 1 and you're the only one who has it. It doesn't make you rare. It's actually really normal. But little caveat, if you look back in your family tree, you might find a few people in your family who had type 2 who might have been misdiagnosed with type 2 and they actually had type 1. I've also met a lot of people whose children were diagnosed with type 1 and they think it's so strange because there's just no presence of this in our family's history. And then 5 years later, the mom or the dad or the grandfather is finally diagnosed with type 1 diabetes. Their diagnosis just came way later in life than their child's. The flu, the chickenpox, the vaccine, puberty, whatever it was, that did not cause your type 1 diabetes. It didn't. That was just one of the last triggers for the onset of stage 3 in type 1 diabetes. Researchers today also know that long before stage 1 even occurs, there is this moment where your beta cells in your pancreas actually make themselves visible to your immune system, and they start kind of taunting your immune system and saying, hey, want to fight? Now, they still don't actually know why that happens, but that was a long time before you got a vaccine or chickenpox or the flu. Okay, that's my rant on what does and doesn't cause type 1 diabetes. Thanks for watching. Want to learn more science? I explain a whole bunch of things about insulin sensitivity, exercise, weight management, and more in this book. It's only 100 pages. It's packed with real-life practical knowledge. You can get Exercise with Type 1 Diabetes on Amazon.